The Medicaid expansion. You block the Medicaid expansion, and you're also building the constituency for reopening this law and repealing it at the federal level. Why? Well, you may not know this because the way they complain, but hospitals actually signed off on this law. They signed off on Obamacare. They knew that there would be cuts in Medicare payments on one side, and cuts in what we call dish payments and maybe some taxes that they didn't like. But there are also a lot of subsidies coming their way on the other end through the exchanges and the Medicaid expansion. And remember, they thought the Medicaid expansion was going to be mandatory. Then all of a sudden, the Supreme Court made it optional for states, and now they're panicking because they thought and they were right. They were going to be making out like bandits. They were going to get a lot more in subsidies than they were going to lose in really reduce the subsidies. But now that money, if the states say no to the Medicaid expansion, that money won't be coming in the door after all. And if that's the case, then Obamacare looks like a very different animal. It's a much worse deal for them, and they will want Congress to reopen it. Now, they'll want Congress to increase their subsidies. They won't go to Congress and say, hey, you need to repeal this. They'll say, could you just put those subsidies back or get rid of these cuts? You know, whatever they want, it's going to increase the federal deficit or federal spending. But as long as there's a Republican majority in the House that is saying that is in favor of full-scale repeal and nothing short of that, then they're going to have to play ball with those Republicans. And I've heard that John Boehner has said that he's going to hold another repeal vote soon, so they haven't given up on full repeal in the House. You can now hospitals will complain, and they've got something of a valid complaint. I mean, they signed off on this law, and it didn't work out the way they want, so they kind of made their beds. But they are also dependent on these government programs, which are always going to be getting the prices wrong and are always going to be letting down, I think, both the provider and the patient. So they do have something of a legitimate complaint, but you do want them to be a little unhappy with this law, so that they will put pressure on Congress to reopen as well. The way you do that is you don't let the state expand Medicaid. Now, the reason not to create exchanges, I think the most powerful argument is we can exempt employers in this state from those from Obamacare's employer mandate and that tax by not creating an exchange. The second most powerful argument, I think, is the cost argument. You created an exchange yourself, the state has to fund it. On the Medicaid side, I think the cost argument is the more powerful. Is the most powerful. The state doesn't have the money to expand Medicaid. The federal government doesn't have the money to expand Medicaid. And that's why the 9-to-1 match the federal government is offering, where they say to Arkansas, if you put forward $1, we'll match it with 9. There's no way they're going to keep that up. They have a $12 trillion debt. They're throwing another $1 trillion of debt on that pile every year. There's no way they can keep up that match. So whatever estimates you hear about the cost of the Medicaid expansion to Arkansas, the actual cost is going to be much worse than the direst predictions of the cost to the state. That matters to elected officials, as the elected officials in the room will tell you, because if they have to come up with the money, they have to take it from someone else, and they don't like doing that because then people get mad at them. So that's why it tends to be the most powerful argument when dealing with state legislators, and giving them reasons not to create or not to expand the Medicaid program. Now, unfortunately, your governor has made a contribution to the. I should also add parenthetically, before I get on to your governor. What you care about is quality health care, affordable quality health care. You do not want to put people in the Medicaid program.
Amen.
Because 1 out of 3 doctors in this country don't even accept Medicaid. 4 out of 5 dentists nationwide do not accept Medicaid. And these impose real barriers to access to care for Medicaid enrollees, so much that Medicaid enrollees end up using the emergency room as their source of primary care. And supporters of this law have estimated that if you expand Medicaid, on average, about 8 for every 10 people that you bring into the Medicaid expansion, how many of them do you think have private health insurance today? Did I already say the number?
Yeah.
8. 8 out of 10 people that you enroll in the Medicaid expansion already have private health insurance today. So what that means is you will be pulling those 8 people out of private insurance where the access to health care is better and putting them in the Medicaid program where the access to care is worse. That was just a little parenthetical about why you don't want to be putting people in the Medicaid Medicaid program. Your governor made a contribution to this nationwide debate over whether states are going to expand Medicaid, though. He asked Secretary of Health and Human Services, CATO Institute, wait a second, what if we took the Medicaid expansion population, which is mostly childless adults under 138% of the federal poverty level, or about $15,000 per year. What if we put all of them in the health insurance exchange? Instead of expanding our Medicaid program itself, you just took that population, put them in the exchange. Secretary Sebelius said, hey, why not? I don't see a problem with it. And that idea has caught on like wildfire. Unfortunately, well, not quite like wildfire, some people have, Republicans around the country have expressed interest in it, and Democrats have expressed interest in it because Republicans have expressed interest in it. I think that the Democrats know that as long as we get that money flowing, it's never going to stop, and the government's going to be controlling private health insurance, and so they like it for that reason.
The immortal government program.
Republicans seem to like the idea, unfortunately, because there's a crony capitalist streak that goes through Republicans, where they say, oh no, we don't like big government. Oh, but if you're subsidizing private industry, we like private industry, sure, give subsidies to private industry. They see it as a less problematic way of covering the uninsured or expanding Medicaid than expanding an explicitly government program. It's going to be a government program anyway, because he who pays the piper calls the tunes. It doesn't matter if you call it private, but be that it's okay. There are a lot of problems with BB's proposal, though. The biggest one is that it's going to cost more.
That's right.
The Medicaid expansion itself is going to be incredibly expensive for the state and the federal government under current law, which includes that unrealistic 9-to-1 match. The federal government's going to renege on that match, making the Medicaid expansion even more expensive for Arkansas. Now, what Governor Beebe is proposing to do is make it more expensive still, because enrolling someone in health, if the government pays to enroll someone in health insurance through an exchange, they're going to be paying $3,000 more than if they enroll that person through Medicaid. $3,000 more. So the cost is going to be higher for the federal government. The cost is going to be higher for the state, and because those Medicaid expansion folks are on average sicker than the people in the health insurance exchanges, they're going to increase premiums in the exchanges. So not only are the federal and the state governments going to be spending more, but consumers are going to have to spend more under Beebe's proposal, because he's going to be increasing the cost of private health insurance. There's something a little bit unseemly about Beebe and Sebelius even discussing this idea, because as it happens, the Senate already considered this option when they were writing Obamacare, and they rejected it. 2 Senate committees both considered the idea of taking the Medicaid expansion population and putting them in exchanges as Governor Beebe has proposed. They both rejected the idea, and it was Democrats who rejected it. The Democrats on those committees said, we can't do it, it's too expensive. It'll increase the cost of the bill. I think it was $50 billion nationwide, but that's using a lot of the funny math that they were using to make the overall cost of the bill look less than it actually is. Well, let me just give you an idea of just how opposed they were and how high they thought the cost would be. Jeff Bingaman, senator from New Mexico, Democrat, on the health committee of the U.S. Senate, said, for our committee to say that anyone covered by Medicaid could opt to go into the exchange and obtain subsidies, I think would just add to the cost, and I would have to oppose the amendment. The chairman of the Senate Finance Committee, Montana Democrat Max Baucus, was even more strident. Quote, I must say, this is a very bad amendment. If you're concerned about affordability, you will reject this amendment outright immediately. This one just blows affordability out the window. We cannot accept this amendment. I cannot understand how anybody would vote for this amendment. So there's been an estimate put out by your DHS that, oh, actually this wouldn't increase federal costs at all. Well, here I'm going to take the federal government's word, the Congressional Budget Office's word, on what's going to increase costs in the federal government. It's going to, and it is going to increase costs in the federal government and states. And if Congress has rejected, even if it didn't, if Congress has rejected this idea, that means that Captain Sebelius has no business signing off on it. Congress has spoken. Another couple of reasons why Beebe's idea is going to be bad for Arkansas. One of them is, if you enroll people through the exchanges, if you enroll those people through the exchanges rather than the Medicaid program, employers are going to be more willing to drop their coverage. So Obamacare would be throwing even more people out of their existence. And finally, Beebe's proposal creates this weird effect. Remember how I said that Medicaid expansion population is mostly childless adults, and how they would go into the exchanges where they would have private health insurance, and how private health insurance offers better access to care than the Medicaid program. You would have this weird situation in Arkansas where bachelors, low-income bachelors, because they'd be in the exchanges, would be getting better access to health care than low-income parents who are in the Medicaid program. So I wanted to say that was a thumbnail sketch of the Medicaid and exchange parts. There's nothing thumbnail about that. I want to stop and answer any questions that you folks have. Yes, ma'am.